started the timer and here is your question. Right. If you have read and understood the question, kindly begin your communication skills station.
Okay. Good morning. My name is Dr. Zaid. I'm one of the surgical doctor on the clinic today. I know you are here sending by your GB for to do CT scan for your husband, and I'm here to explain everything to you. Just I want to know what you know so far about your husband.
Actually, who are you? Actually, I had an appointment with some other doctors.
I'm sorry to let you know, to let you wait. I'm Dr. Zaid. Mr. Man, he is not here at the moment because he calling for emergency surgery case.
So
I'm here to explain everything for you. Just please.
No, I got the information that we had to get the CT, but should we get the CT? Means what you did? What is the problem with my husband?
Yes, I will explain everything for you. If you please, could you sit down, please? And I will explain.
Yes, no problem. No, okay, I'm sitting. But just you explain me.
Yeah, I will do. Yeah. If you don't mind, please, could you tell me what do you know so far about your husband?
No, we said GP that my husband has got breathing problem and he has got a large tummy, and then some doctor removed the fluid from the tummy and sent, and then now they are telling that there is some cancer. I don't know what exactly is that, and why there is need of the CT scan.
Yes, you are right. You're right. Your husband have this tummy swelling, and doctor draw is sample fluid from his tummy, and unfortunately, the result come back, and your husband have cancer cell.
Oh my God. Okay.
And in this case, the doctor sent him here to a CT scan to find where's the primary.
No, doctor, when you have already diagnosed there is cancer, then why you are required to do the CT scan? You can directly go for the treatment. Why we need CT scan?
Yeah, to answer you on this question, I should know what is the primary site of this cancer and what the stage of this cancer is, if he is in place or spread to other places. And I know to know everything about the type of cancer also to decide what the suitable treatment.
Okay.
Okay.
So send
Yeah.
us for the CT scan.
Yeah, I know you are here today for CT scan, but I'm sorry to say that for CT scan at the moment in under maintenance.
You mean the CT scan is not working?
Yeah, it's not working because it's under maintenance for the past 3 days.
So what should we do? What are the other alternatives? What we can do? You will advise us.
Yeah, we can.
Why we are waiting then?
Yeah, we can do for him now a GL scan. This is kind of like what we do for pregnant woman, and thus can give us a clue about how much fluid inside his tummy, if there is any malignant, if there is any cancer in his liver or other organs.
Okay.
Yeah, but it is not scan, because a CT scan is more detailed than GL scan.
Any other options you have other than CT scan or this one?
Yeah, we have other option, but we need Mr. Mann to consent on this scan, like MRI scan.
Okay.
Yeah, but
and
but I need Mr. Mann to come to agree on this scan.
Tell why as well.
But if the CT scan in your hospital is not working, then why you can't send us to another hospital?
Yes,
I think your hospital is very small. You should send us from beginning to another hospital.
Yeah, you are right. Our hospital is small and we have a short resources, but we try to do our best to make an investigation for any patient like your husband within 2 time frame. And transfer to other hospital, this is one option. If you are like to transfer to other hospital, I would arrange this.
Okay. Can you arrange it now? Or wait?
Yes, I can arrange now. I can call other hospital and also prepare to transfer your husband by ambulance.
Okay, doctor, you tell me. You said that my husband has cancer. Are you sure he has a cancer?
I tell you, to answer this question, I should know where is the primary site of cancer and what's the stage of cancer. Know what's the proper treatment also for him.
Okay, so my husband will need surgery. He had to go to an operation for this cancer.
I'm sorry to see that in your husband's situation, the surgery is not benefit because the cancer is spread to his tummy, and we found a malignant cell in his fluid in his tummy. Surgery is not an option in this case.
But I see that he is not taking breathing properly. He has the problem of taking breath. He's in very difficult situation. So how you cannot do anything right now?
Yeah, we can help him with this. We can draw a blood, some fluid from his tummy, relieve his tension, and he can breathe most comfortable than now.
Okay, so doctor, my husband's brother is traveling to some other place, and I want him to come here so that he could help me. So I want to inform him. Can I inform him now?
You want to come?
Okay. And so we will do the CT scan.
Now we just let me recap what we said. You are here for CT scan, our CT scan under maintenance, and we have an option. We can do for him GL scan. We can wait to Mr. Mann until he come to agree on MRI scan, or we can refer you to other hospital CT scan. What's the most proper for you? You want me to refer him, or you want to wait, or we can do for him GL scan now at the moment?
Doctor, I'll wait for that.
Okay. Thank you for your cooperation. Just wait here. I will come to you with Mr. Mann.
Good.
Okay, thank you.
Thank you. Yes, feedback, Dr. Suman first.
I think he did well, but he should inform you in the first place that CT scan is not working. Although, yes, otherwise he did well.
Yeah, he did well, but I was just thinking primary site or from where the cancer has begun, maybe more even lay man language. but then it was good, and he concluded it and covered it within given time.
And another thing that it is better to inform the brother only after getting the full picture
Full,
of the
yes,
CT scan.
information.
Although he is free to inform, but doctor will suggest that only after getting the full picture, you better. He's traveling right now, to better inform him after getting full picture.
Yes.
I really I don't
After
have this
CT scan.
I don't have this question here. I just answer from my mind.
Yeah.
Okay, okay.
Yeah.
It's okay.
Okay, good. Anyone else want to give feedback? Dr. Abhishek is writing.
Doctor,
Okay, good. Start with the timer. Here is your question. Once you have read this, tell me. There's one more slide.
Yes, ma'am. Can I see the next slide, ma'am?
Yes, please. Right.
Can I see the first page?
Yes. Sure.
Right. I'd like to start, ma'am.
Okay. Good.
So, hello, hi. My name is
Right.
Dr. Sridhar Murli. I'm one of the doctors working for Mr. Man. Can I confirm that I'm speaking with the cardiothoracic surgeon on call, please?
Yes, cardiothoracic surgeon with you.
Hi, sir. Good evening. I'm calling to refer a patient to you, if that's okay. A 23-year-old gentleman who presented to us in a motorcycle accident. On examination, on presentation, he was drowsy. He complained of right-sided chest pain. On examination, his GCS was 14. His heart rate, and on examination, the swollen left thigh and no obvious open wounds which were visible. I'm referring to you because we did a chest X-ray which revealed that there was a widened mediastinum, and we did put a chest drain which drained about 200 cc's of fresh blood. We couldn't do a CT scan as a machine over here has been serviced for the next 3 days. We won't be 3 hours, so we won't be able to get that. So I was wondering if I can refer the patient to you.
Okay.
In the meanwhile, we started resuscitating the patient with 4 liters of fluid. We've given him 6 units of blood, and we've arranged for 6 units of blood on standby. And can I have the next slide, please?
Yes. Yes, please.
Yeah, we've done a chest X-ray which shows widened mediastinum and bilateral pleural effusion. And like I said, we've inserted a chest tube which showed which drains some amount of blood as well.
Okay, could you tell me what's the result of his blood test?
Sorry, ma'am. Sorry, sir.
Result of his blood test.
Test results.
So his bloods basically show that his hemoglobin is 8, and rest of his bloods are fairly fasting blood sugar. FBC is normal. Liver function test and renal functions are normal. CRP is mildly raised, and ABG is relatively mildly acidotic. PaO2 is normal 10, and the PaCO2 is 6, and the bicarb is 19.
Okay.
And he's also a non-diabetic as well.
Okay. What will you do for?
So the acidosis.
Okay. What will you do for
Sorry. Yes.
for his cervical spine?
So we'll triple immobilize the C-spine, so with a hard collar, banded, and sandbags.
Did you do it or you? Okay. What will you do for the legs?
We'll use a Thomas splint to immobilize the leg.
Okay, what about the blood pressure? You see, he is hypotensive or
Yes, so we have started fluid resuscitating him, and we've arranged for 4 units of cross-matched blood as well. There is a long bone fracture. There is a possibility that there's grade 4 hemorrhage. So we've arranged for blood products as well. Starting fluid resuscitating, and then we'll move on to blood products if required.
okay. You tell me his EBG show metabolic acidosis.
Yes,
What
sir.
do you think? What's the cause?
I think it could be because of the trauma. It could also be because of the shock that he's having a lot as well, and he's also non-diabetic, so there could be an element of diabetic ketoacidosis as well.
Okay, what about his abdomen?
So that's mainly the reason why we're referring, because the abdomen, although soft on abdominal X-ray, there is the soya shadow is not seen, and there is some dilated loop. So we found that there's something going on in the abdomen. So we need a CT. Unfortunately, we're not able to do it over here.
Okay, you can do for him fast scan or
I will see if I can arrange for that. So yes.
okay. Now okay, you can transfer the patient, but before that is who will accompany the case?
So I will accompany with one of my colleagues from ITU. Will accompany the patient over.
Okay. Before you come here, you are scan.
Yes, sir. We'll
You are
arrange for
calling
that.
for
Yes.
you are calling for orthopedic surgeon and be sure your cervical is stable.
Yes. Yes, sir.
Okay. Okay. Thank you.
Okay,
Okay.
sir. Thank you.
So quickly you've finished. Did you ask about the how to increase the blood pressure, or
Yeah.
what would you do for
Yeah.
the BP?
Yes, ma'am. That I'll start fluid
Yeah.
resuscitation, and because
Because
this is
you
a long bone fracture, we should consider it as a query grade 4.
still had 3
So we'll start off
minutes.
with fluid resuscitation and consider blood products.
Yes.
I could have summarized, but this is a little
Yeah.
difficult with 2 slides. I mean,
Yes, I'm sorry. Everything couldn't be
no,
on
no, no.
one slide.
This,
But then you can summarize because you still have time.
um, so just to summarize, so this patient to you is 23-year-old gentleman who's a known diabetic, presented to us with a motorcycle accident. On examination, on primary survey, his GCS, his airways patent, his breathing is fine. His circulation, his heart rate is 120, and BP is 100 by 80, and GCS is 14. EVG shows a mild acidotic picture. His pH is 7.3, and on examination, there is a left eye swollen, and there's no obvious open wounds, no obvious fractures. We've started fluid resuscitating him, and we've arranged for bloods on standby. Um, I mean, our current initial adjunct on investigation showed that there is a widening of mediastinum and bilateral pleural effusion, for which we've done a right-sided intercostal drainage, which brings amount of blood. And also there's a mediastinal widening that is visualized on the X-ray, and the abdominal X-ray done shows absence of soya shadows as well. So we're referring mainly for 2 reasons, and also dilated bowel loop. So we need CT, which unfortunately is not available in our hospital. So I'll start fluid resuscitating the patient. I'll arrange for a bedside fast scan. I'll also make sure that the C-spine is immobilized, and start resuscitating the patient, and I'll arrange for the transfer.
Okay, good. Still have 1 minute.
Thank you, sir.
And you can tell what kind of whole team will accompany and what type of ambulance you'll be requiring.
Yeah, I will accompany the patient along with one of my.
Good. Everything went so well, and you still have a few seconds. Okay. Yes, Dr. Zaid, would you want to give feedback?
From fast scan and call orthopedic before.
Yes. Thank you.
Thank you.
Yes. Good. 8 minutes became so long for you people. 10 seconds. Yes, anyone else?
So we
want
have
to give
9 minutes to
feedback?
prepare before the station, and on the station we have 9
Yes,
minutes.
yes.
Ma'am,
Ma'am, we have 9
regarding
minutes.
the
Yeah.
maintenance of blood pressure,
Yes.
I think in cardiac tamponade, that is what we should not increase the blood pressure too much. It should be a
Yeah,
maximum
he did say
limit,
that.
so that it should not. There will be fear of increased bleeding there. So we should, as the blood pressure is already 100 by I think 80, and so we'll keep the blood in standby. If blood pressure falls, then we'll start. We already given the 4 unit of crystalloids, I think.
Yeah.
Yeah, you're right. We can maintain the blood pressure, but not high.
4
Not
units of
increase the blood
crystalloids,
pressure.
6
What
units
is
of
there?
blood.
It is 100 by 80, so we will maintain at that. In
Yes.
the fear, for the fear of there will be increased bleeding in the cardiac cavity, maybe increased bleeding.
Good.
Not only in tamponade or even in aortic injury.
Yeah,
If you increase
even in
blood,
aortic injury, yes, aortic.
if you increase blood pressure, is rupture for clot.
Yeah,
And
yes, yes.
Good. Yes.
There may be aortic rupture. Yes, that also is a contraindication of more increase in blood pressure.
Yeah. Good. Okay. What is your question? Right. If you have read and understood, kindly begin your station.
Hello, Mr. Tom. I am Dr. Jaita, one of the surgical residents. I am here to talk to you
Hello.
about. Hello, Mr. Tom. I'm Dr. Jaita, one of the surgical residents. I am here to talk to you about the operation that you're supposed to have.
Okay.
Yes. Do you know anything about it?
Doctor, as far I know that I am doing the operation of over my head for some brain tumor, and if everything is okay, I will be cured. And I understand that there are certain risks, so I hope that I will be cured and the tumor will get out.
Okay. Okay, Mr. Tom. Yes. So you're going to have what we call a craniotomy. It's like we're going to open, like just like you said, your skull. That is the bone up on your head, and then we're going to open it to remove the tumor that you have.
Okay.
But this require you to be transfused with, that is to be given blood, about 4 units of blood to be given to you before, yeah, for the surgery.
No. I don't want blood to be given to my body. It is against my faith.
Okay, I understand, Mr. Tom. But this blood to be given to you during the surgery, if need be, it's very, very important to save your life, because this tumor that you have is it has many blood supplies, so it can bleed during the surgery, and then this might be very fatal to your life. This might be very bad to you.
I can understand that there is a risk, but still I will not allow you people to transfuse me the blood. I will not allow.
Okay.
To refuse that.
Okay, Mr. Tom. So since I've explained your condition to you, and do you mind telling me again what I've said to you?
Yeah, you told me that I'm undergoing a surgery for my brain tumor, and for that it has a blood supply, rich blood supply, and if surgery will go on, it will cause too much bleeding, and if I will not undergo the blood transfusion, then I have a risk of even life.
Okay, so okay, that's all right. So now I want to suggest to you another option, since you told me about your apprehension. This we could maybe get you to before your admission, to get you to your GP, so that you have to optimize you. And then also we will have another option, like we'll take your blood before the surgery. We'll keep it, save it for in case that this thing happens. The bleeding happens, and then also we will inform the people in the theater, so that we will try and minimize bleeding as much as possible. We will try all that, but we were saying this in case you really need blood, this is what you will need. And also there's also another medication we could give to you to help with your blood production, but this is...
So these are the alternative options. Can you tell me again about that alternatives? Yes. Because yes. I don't want the blood transfusion.
Yeah, so this
tell you again.
Okay, that's all right. So this alternatives will give you one medication called erythropoietin, which will help you for your blood level. And then also another thing is to collect your blood before the surgery is being prior to maybe a couple of weeks before the surgery. We will bleed your own blood, keep it in the blood bank, so that when the operation and then comes, you will use it when it is required. And then also we will give you we'll talk to the surgeon and then the anesthetist. They will make sure that to do as much as possible, so that you won't bleed. And in case you also bleed in the theater, we'll have to abandon the case, and then yeah.
Okay, doctor, I'm okay with that. You better talk to your consultant and the anesthetist, and also inform the GP. I am ready to go that, but I will not ready for the transfusion. It is against my faith.
Okay, Mr. Tom, I understand your apprehension. So we cannot do this in a legal way. So because you will have to sign a document saying that you're the one that you don't want to be transfused. It's against your religion, like you said to me, and then that you would prefer the alternative methods. So, and then in case anything happens, and then we'll have to abandon the surgery, and then it's not all right. That's what we have discussed, right?
Yeah, it's okay, doctor. I'll sign that I am ready for the surgery without any blood transfusion, and you will arrange me before that.
Yes.
Okay, I will sign that.
And then that also that your life may be at risk because you could die in this process as well. I forgot to tell you that fact. Is that all right?
Okay, doctor. And is there any other alternatives to the blood transfusion?
Yes, that's what I told you about the. Sorry, that's what we talked about before.
How post-operatively you'll make sure that patient does not become dehydrated?
So I will make sure that post-operatively we give you enough fluids, and then we'll make sure that you also will monitor your urine output. Yeah, and then we'll make sure that we'll do your hemoglobin level as well to monitor it. If it's going down, we will know what to do.
Okay, doctor.
Okay, so we'll bring the form, the legal form, for you to sign it before the surgery, and then the theater people, the anesthetist, the surgeon, will all be involved. You all know about the case, and then everyone will be informed. Anyway, so let me summarize again. So, Mr. Tom, the 80-year-old, I've presented to you about, I've explained to you about the procedure that you're going to have. and then that you might need 4 units of blood, and then to be transfused. But this process, you have refused, and then you want alternative methods to be done. And then also, I've explained to you that the theater staffs will be informed, the surgeon, the anesthetist, and everyone involved in your case. And then post-surgery, that you will be, will monitor your hemoglobin, that is your blood, to see how you're doing, and will give you adequate fluids. Is that all right?
Yeah, if you are assuring that we will not transfuse the blood, then I'm ready for the surgery, doctor.
Okay, thank you so much, Mr. Tom. I will relay this back to my consultant. Thank you.
Okay.
All right, good. Thank you. Yes, Dr. Suman, would you like to give feedback?
I think he should also leave her number in case I have any other queries. I think this is
Okay.
the one thing we should do in every communication discussion.
Yes, this is something you should do in every, when you are communicating with the patient only, not with consultant.
Yeah. Yeah.
Okay, anything else you could have done better?
I think this one is a small station, not very
Yes,
huge.
but
Only
still,
thing is to replacement. What is the alternatives of the blood? What are
yes.
the risk factors? And it is still ready if he will die.
So one option, Dr. Fatimata, of saving patients' own blood and then giving it
Yeah,
when needed, cell salvager, that is not required
cell
in this
salvage.
because
Yeah.
patient is already, it has tumor, right? So if you give tumor containing blood to the patient again, it will cause seedling, it will spread the cancer. So this you will not do.
In this
Other than
condition,
that,
yes.
you can explain, like you told erythropoietin, you can talk about more if there are any other analogs to blood, or how you
Tranexamic
maintain the
acid.
homeostasis during surgery. So you can discuss that, you can elaborate that, and then yeah, I reminded you like how you will take care of. First, begin with preoperatively how you manage, how you'll establish the patient's blood by hydrating and consulting hematologists, etc. And then during operation, you'll consider the hemostasis, then post-operatively as well. So this, and when you were discussing, you remembered later on that patient can die as well, and that in that instance, if you could explain that there could even be many serious complications like stroke, or you even can die.
Okay.
So add one or two more serious things to convince the patient.
Okay.
Yeah. Otherwise, I think it was okay.
Ma'am, I have one video. I'll share that. There is another scenario where there is a child who
Yes.
got
Yes.
trauma and bleeding,
Yes. And
abdominal
parents are
bleeding.
refusing.
It's a blood transfusion. So
Yes.
we are discussing with the parents for that, and we have to enforce them that we will do the blood transfusion if needs. In that condition, we have to do the blood transfusion. That is what I saw in that video.
Yes, because
With
whenever there
discussing
is
with a legal
emergency,
team.
when there
Yeah.
is emergency, then you ignore.
Yeah.
There is a Jehovah liaison office in
Yes.
each hospital.
Yes.
If you need any advice, or you have you want to convince the patient, you can call them, come and talk to the patient, give your
Yes.
policy, everything.
Yes. So it's
Okay.
better to know that as well. Good. Thank you. Started the timer, and here is your question. Right. If you have read and understood, can you begin your station now?
Hello, I am Dr. Suman Kumar, CT3 under Mr. Mann. Can I talk to, am I talking to Mr. X, the consultant on call?
Yeah, speaking.
Yeah, sir, actually we have an elderly lady who has undergone her mastectomy with axillary clearance and today is second post op day. She also has a history of COPD and mild left ventricular failure. Now she has developed axillary swelling and shortness of breath. And now her daughter, she wants to take her home. And for last 20 minutes, I tried to tell her that it's not in the best interest to take her home, but it's all gone in vain. And I also see that there is a collection in the drain bag. So I just call you to inform you about that, sir.
Right. Do you think the patient has taken this decision? You're saying that the doctor is bullying the patient to take this decision, is it?
Actually, sir, I think that her daughter has convinced her is for the best to go with her and live with her, because her daughter has the office to go there and she cannot come again to the hospital to see her. So she somehow convinced her. Although I think the patient he was ready to go her own home after she becomes well.
Okay. What does the patient want? What do you think the patient wants? Is she capable of making her own decisions, or what does
Yes,
she
sir.
think?
I talked to the patient. She is competent to give an informed decision. She can take a decision. Competent.
Okay. So what does she want? Does she want to stay in the hospital until she's better, or
I
she wants to?
actually her daughter convinced her, so she wants to go home with her, which is
Oh, I see.
about very far from here.
Right. So what do you think is happening in this case? What do you think is happening with
Uh,
this with her surgical site?
Sir,
You're saying there's swelling
she
and
has
stuff.
got swelling in the axilla, and also there is fresh blood collection in the vacuum drain. So I think there is possibility of or chances of the reactionary hemorrhage at the wound site, and also she has developed the shortness of breath. So I will have to consider possibility of and pulmonary embolism, or there may be the acute exacerbation of the COPD.
Right. So if that's it, that is what we're suspecting, that we need to investigate that, isn't it? So are you still
Uh,
not able to convince the patient?
Actually, I try to convince them that we have to take these action because she is developing the complications. So we have to hemoglobin if there is continued bleeding, and we have to also maybe the hematoma which may need to be drained, and also for the pulmonary embolism and for the development of DVT, we have to do the pulmonary angiography as well as the duplex scan of the arm, and
Yeah.
I'll try to manage according.
Okay. So if
That
they're
I
not still, if they're still refusing as to what do you would think you'll do if they're still refusing to
in that case, sir,
stay?
I'll discuss with the patient and her daughter again about the complications and the risk if they will go to the house early, which is very far from here. Then I'll also uh, uh, discuss with the patient about any sign of the complication, and if she got any signs such as that, like there is more wound discharge or there is any increasing of the shortness of breath, she has to come immediately to the nearest hospital, or she can come directly to here. And other than that, I'll also discuss with him that they have to the patient has to sign a legal document that
Good.
their own, and if any
Yeah.
complication occurs, they will be responsible for that.
Yeah. And get them to sign an AM against medical advice discharge form. And they're going
Yeah,
against
yeah,
medical advice.
yeah. They have to sign that legal document that they are getting discharged against the medical advice, and they will be
Yeah.
responsible for any complications.
Yeah. If she develops any complications, she can contact any local hospital and tell to be evaluated by the surgical team urgently. So you can just mention
Yes,
that as well.
yes, yes. That's what I'll explain.
Yeah. Okay, yeah, that works. If that's the only option now. Thank you
Okay,
for
sir.
letting me
Discuss
know.
about the social services.
I want to summarize what I
Yes.
have.
Social
Because
services.
Yeah,
patient
actually,
might
sir,
have a drain or
at
yes.
the home, I'll
Dr.
leave
Devani.
the drain in place. I will not remove the drain in place, and also I'll write a letter to the GP or her GP, so that GP will visit her home and take care of her any symptoms, or take care of the any bleeding which will occur, and see regularly to her. I also make some social arrangements that her daughter is working, and her daughter husband is also working, so there will be nobody to see after look after her, so we'll have to arrange some social worker also, sir, to
How
look
will you
after
arrange for
her.
the drain to be removed?
No, sir, we will not remove the drain right now. We'll write a letter to the GP about the drain. If there will be no further increase in the drain amount, then remove the drain, he will remove the. Otherwise, we can send the patient to the back to the hospital at our department, sir.
Yeah. Okay. Thank you.
Okay.
Now you can
So
sum up.
I want to summarize the case, sir. So this elderly lady who had got the mastectomy with axillary clearance for the breast cancer. Now on second day, she has fresh blood in the drain, as well as there is axillary swelling and shortness of breath. Now, as her doctor wants to take her home with her, and I convinced the patient and the doctor, but they are not willing to stay here. So I'll again explain them about the complications and what they may require to sign getting discharged against DAMA. And finally, I'll also write a letter to the GP about mentioning that he will visit her home and check regularly about the symptoms and take care of the drain. And if any complication occurs, they can come back to the hospital or nearest hospital. Okay, sir. If you want me anything other thing to do,
No, that's fine.
Good.
Thank
I'll
you.
update you about it.
Thank
Yes,
you.
you still have 20 seconds left. Okay, very good.
Yes.
Yes. Something you forgot, but then you remembered and you
Actually, I think there is one more question, that what will you write to her GP? What in later? What
Actually,
will
in
you
the
write?
yeah,
In the
in the
later,
long
what will
term,
you write?
often in one thing that asked was what is the long term plan for the drain to stay in? How many days do you want the drains to stay in, and what does the patient needs to do? They need to monitor the output on a daily basis. Either they can empty the drain by themselves, or the district nurse or whoever is a social worker coming home can do that, and then monitor the output and report to the GP, and then remove it later on, either at the GP or it can be done as an outpatient, as an ambulatory care over here. I mean, the hospital. So
Yes. Right.
Yes.
I,
Yes.
I can see one thing in this case,
Yes.
because
Yes.
I have also my mom have the same complaint here, and
Really
the
sorry to
patient,
hear that. Yes.
yeah,
sorry to hear that.
she removed her breast and with drain and all these things that happen, and there is nothing for it. There is a clinic will contact with the patient regularly and give a patient a number. If there is anything happen, we can contact directly with the breast clinic nurse. She can arrange to come to the home, or a patient can come back to the breast clinic to remove a drain, to dressing, to
Yeah.
see a wound. She is not do anything in this case. Her surgery done for breast, is a breast clinic. She will follow the patient until patient is well and finish all things.
Yes. In this case,
Yeah.
patient lives so far away as well. I think 20 miles
Yeah.
away or something.
This, I mean, this is Dr. Zaid. Sorry to hear that, but this, I mean, is AMA. I mean, against medical advice discharge. This is basically legal aspects of things that discuss GP. Somebody
Yes.
should follow.
Yes.
Yeah, she will follow the breast clinic
No, but breast clinic is only available during working hours. Off hours only
Yes.
GP.
No. Available 24 hours.
Oh,
Yes,
okay.
but
I didn't know that.
that would be for those patients who are going home with their own, with the doctor's consent, not with their own, like
Even
self-discharge.
with the self-discharge. The same.
Okay.
Yeah.
Okay. Good. Thank you so much, everyone.
Yeah.